Hello and welcome to another live broadcast with MedStar Health. My name is Sarah Ridenauer, and I'm joined today by Dr. Ashwini Sardana, internal medicine physician at MedStar Health Primary Care at McLean. We're excited to discuss ways to make your health a priority in 2025. As we continue to welcome the new year, it's a perfect time to set goals and establish habits that are not only meaningful, but also achievable. You've been so focused on giving to others these past few months. Now it's time to focus on yourself, especially your health. So stick around, share this broadcast with your friends, give us a like to let us know you're watching. And if you have any questions, you can ask those in the comments. So let's work together to make your health a priority. Let's start by getting to know our expert. Welcome, Dr. Sardana. Thank you for joining us today. Before we get into the questions we have for you, would you introduce yourself and share a little about your background?
Yes, absolutely, Sarah. It's a pleasure to meet you here and to connect with the community on Facebook. I'm Dr. Ashwini Sardana. I'm a primary care physician, medical director at MedStar Health Primary Care in McLean, Virginia. We have a crew of 3 physicians here, great setup with specialty backup, imaging, the whole 9 yards. I've had diverse experience and background in primary care, emergency medicine, telemedicine, and urgent care, and happy to work for the community in the DMV area.
Great. Well, thank you again for joining us. And let's get into the questions. So, like I said, beginning of 2025, it's a new year and time to rethink our health goals. So, why is it important to see a primary care provider before making changes that impact our health?
Sarah, life is a pretty long journey, and my promise to my patients is that we'll work with you from 0 to 100. And during this lifelong journey, I want our community, our patients, to know that your PCP is your friend, your mentor, your guide, or if you would, your quarterback in this journey of life while we help you steer the medical illnesses and so on and so forth. So
I
it's
love
good to
that.
connect with someone who is a medical expert so that your journey is meaningful, healthy, and lively.
I love that. Your quarterback of life. That's a great way to put it. So can you talk a little bit about goals versus habits and why it's important to focus on both?
So goals are what you see yourself to be, where you want to be, what you envision for yourself, whether it's good health, whether it's to become an athlete, whether it's to master a sport. And then habit is more your general day-to-day lifestyle. That's what is kind of ingrained into your mindset that you would walk this much every day or you would practice this much every day. So there's a little bit of a difference in the two, yet they're both like 2 spokes of a motorcycle.
Mm.
They have to work together. The right hand needs to know what the left hand is doing, and they both have to go in the same direction towards a common target. So that's where we are on goals and lifestyles.
And so, what are some effective strategies for setting realistic health goals this year?
I'm glad you asked it because more than 75% of us keep our physical well-being as our top priority at the dawn of every new year. My thought process is for discussing with patients to help them create small and attainable goals which are specific and measurable. I mean, just for an example, you would say just being fit or staying healthy is okay to think about, but a more appropriate and a scientific way is how would you do that? So let's say you want to exercise 3 times a week, or you want to cut out fast foods. So that way, your lifestyle helps you go towards a specific goal. Also, it's great to break down the larger goals into smaller portions
Mm.
because smaller portions, small steps help you go towards your journey. I would also think we got to be flexible and practical in this approach. Some days the goals may not work. Some days you may not be well, you may be traveling, you may be caregiving for someone. So it's okay to adjust that, keep that margin in our day-to-day changes which affect us and our working. If we could come up with a routine that, this much time you want to give towards your exercise, your physical activity, that way you kind of keep your goal and target and you don't fall off the schedule. And lastly, I would discuss with patients about seeking out help, getting connected with friends, family member, a neighbor, because that peer support, that communal strength of many people going towards the same goal gives a purpose and more momentum to your journey.
Yeah. Yeah, I agree. And it's nice too. They can hold you accountable and help you along the way. I also like you talking about breaking down the larger goals into smaller. I did that recently actually with my goals for the year, and it puts it into a different perspective and makes them seem more, like you said, manageable tasks, and
Sure.
rather than just some big goal. Um,
Yes.
so I like those tips. And what are some common challenges? You touched on this a little bit, but some common challenges people face when trying to establish new healthy habits.
So one challenge I see is that we sometimes are overambitious.
Mm,
Just because my neighbor has six-pack belly doesn't mean I can get a six-pack belly. Just because so and so is a master in marathon doesn't mean I can be that. So it's good to be realistic, not be over ambitious.
mm,
See where you are, what your lifestyle is, what your daily schedule is, what your health is. Maybe your joints are creaking and groaning. Then it'll be important to go slow, take one step at a time, see how much your body can handle it. Don't be start lifting 200-pound dead weight, if you're not built for that, because you got to slowly build that foundation to a point where you feel ready to take off. So one thing would be to be realistic and not to be over ambitious. Like we discussed, it will be good to have a group, because with a group, that strength, that learning from each other, that camaraderie, that social part of it makes it fun, makes it attainable, and you learn from each other. You share experiences of each other, you share notes. It's just a good experience overall. And then finally, discipline, because you got to create that discipline mentally about this is the lifestyle, this is the activity, this is the daily schedule I'm going to be following. And yes, once in a while it can throw you off. Once in a while, it's okay to have that slice of pizza you've been craving for, or that burger shop which you stop by every day on back work. It's fine, it's fine. But by and large, if you check off those major boxes towards your journey, I think that will be a great way to go.
yeah. And what are some dietary changes you would recommend for someone looking to improve their health?
So 80% of our physical well-being, our health, our weight is from diet, and exercise counts the rest 20%. So you can see the impact, um, the significance of diet. So I'm glad you brought that up. I generally share with my patients and friends the importance of proportions and balance. It's good to have a 35 to 40% carb, 30 to 40% fats, and 35 to 40% proteins in your daily meal thing. Of
Mhm.
course, if you are a footballer, if you're very active into sports, you like burn 2000, 3000 calories, you might need to up the proportion of carbs in your plate.
Right.
That being said, half of the plate when you sit for dinner should be fruits, greens, or veggies. The rest half can be grains, nuts or seeds like almonds and cashew,
Mhm.
with another portion for lean protein, and then a little dairy or a little fat on the side like cheese or mayonnaise.
Right.
So if you check off both of those boxes in your dinner plate and your portions, I think that'll be a good way to go. Of course, we have resources. You can always reach out for a nutritionist. You want to break it down. What should be by morning be? What should be by mid-morning snack be? That's always helpful to get an expert like a nutritionist.
Right. And now my next question is something that I know I struggle with a bit. People can be busy and it's hard to incorporate, physical activity into their daily lives, find time to work out, do things like that. What is your advice for how individuals can get more physical activity into, their daily routines?
So actually, Sarah, when you tell me people are busy, I like that. I think it's important to stay busy. It's
Yeah.
important to stay busy doing something, moving forward, thinking of something, executing something, planning something, or working on something. That being said, it's always important to have a time management. And that's why we have a 40-hour week. That's why we have a federal holiday, a 2-day weekend, pretty much for everybody. So there's always that issue of time management, which we can use to delegate 5 minutes, 10 minutes, half an hour, maybe more if your time allows it. If you can't do it in one go, break it down. Maybe 20 minutes in the morning before you sit in front of your computer, maybe 20 minutes in your break, or 40 minutes in the evening. So there's always time. And if you can do 40 minutes, it's fine. You could do 20-minute increments on the weekdays. Weekends, when you have a little more time, you can devote more towards physical activity.
Right. I like that advice. Yeah, that's actually one of my goals is better time management this year. And so I'm trying to figure out ways to make that work. So I appreciate that.
Absolutely. And then I'm flexible with it. The days you
Yeah.
can go out to play soccer, you can, it's fine. Even shoveling your drive yard, even
Hmm.
doing it in the street when there's so much snow is a form of exercise. You got to just be careful, warm up your body, stretch your exercises. But here you exchanged gym time in exchange of shoveling time. So
Hmm.
that's your physical activity right there.
Right. Right. Yeah, I like that.
Yeah.
And now we've talked about diet and nutrition, exercise, physical activity. What about mindfulness practices? What role does mental health play in establishing and maintaining healthy habits? And how can people make that a priority?
Absolutely. The mental health component is probably the underrated or not the much talked about. Many communities, many ethnicities, it's like a taboo to discuss about mental well-being.
Right.
And I'm glad that it's being brought up. We have a plethora of psychiatrists, clinical psychologists, mental health experts to share that. Your PCP is always there for you to talk about that.
Mhm.
The mental health and that mindfulness creates a routine, it creates a discipline.
Mhm.
And that's like the driver of that train, which makes sure the rest of the cars follow in tow. And people are the rest of the cars are not going in opposite directions.
Mhm.
So that mental well-being is very important to as you go through on that journey. Things to help with having a stronger mental well-being are always meditation,
Mhm.
keeping some time for yourself, trying to declutter your mind,
Mhm.
keeping focus on one thing at a time rather than multitasking,
Yeah.
and stress management.
Mhm. You're very good with your analogies. You talked about primary care, doctors being the quarterback of your life. Now you're talking about mental health being the driver of your train. I love your analogies. You're very good with that.
So thank you so much. Thank you.
So now talking about preventative care, what preventative health measures should someone consider as they set their goals for this year?
Sure. So it's a tailored approach where we share with our patients, what they really want. Someone wants to check off all the boxes. They want to make sure their yearly physical is done. They've had their lab work done. They want to discuss their family history of cancer with their primary. Absolutely. You
Mhm.
can't go wrong in that. Now, medical genetic analysis has helped us to figure out if someone has two siblings with a particular condition, are they prone to that? So you can know your risks ahead of time. And the center of all that is your PCP. Once you share that information, you get your yearly physicals, discuss your family history, your social risk factors, you're good.
Yeah.
Maybe you were a smoker in another life. Maybe you were overweight, have a little high cholesterol, you're concerned. What's my heart risk? Absolutely. We'll run the tests like the lipoprotein, the CRP for you. We'll run the tests of CAT scan of for the coronary calcium and tell you way ahead of time, is there a risk for you for heart disease? And information is always helpful because that helps us educate our day-to-day planning.
Right. Right. I like that. And so, what are some common misconceptions about health and wellness that you encounter at your practice? I'm
Oh,
sure you get a lot of
I,
them.
I was thinking about it and we talk about it, and I was going to get my coffee mug which says about the Google search. So, so, so let me share that the commonest misconception that we have or we hear back from our community is about Dr. Google. Just
Mhm.
because you read something on Dr. Google doesn't mean it applies to you. And then they freak out. They're calling us morning and evening. While information is helpful, important, and you should do your due diligence, but it should be analyzed through the lens of a medical expert.
Mhm.
That way, you don't stress yourself. Your family members are not packing because you think you may be getting a cancer overnight. So that's one common misconception, that um, approach analysis of knowledge on Google is important to discuss with your medical physician. The second misconception we feel is, which is a general perception in community, that being thin is very healthy.
Mhm.
Not really. As long as you're by and large in the range of what your BMI says, by and large, you're good. But not necessarily being thin is being the best.
Mhm.
Sure, we don't want you to be way overweight or have a pretty bad looking BMI.
Yeah.
And then when you discuss BMI, it's got to be with the ratio of how much muscle you have and how much of fat you have.
Mhm.
So it's not an absolute giveaway. The third thing is that the modern fad is to detox and clean your gut.
Mhm.
And with that approach, people come to the offices, they want to just detox everything, they want to decleanse everything.
Mhm.
But you got to realize your body, your gut is one of the most efficient machines that you have ever known.
Mhm.
It has the capacity of detoxing itself. That's what your liver, your kidneys are doing every minute while you are awake or you're sleeping. So there's really no important reason to go after all those over-the-counter supplements, going in every direction to detox or decleanse your gut. It's an inherent mechanism which your body is very capable of doing. Let it do that. Vaccines, that can be overstressed. Um, and again, the fact comes that someone got sick from a flu shot or
Mhm.
had a lot of pain or an abscess from a tetanus vaccine. Well, these are one-off things. By and large, these vaccines are our friends. As long as the history of mankind goes, most of the vaccines have helped us to stay healthy.
Right.
So if somebody has a bad COPD, advanced cardiorespiratory disease, getting that flu shot, getting that pneumonia vaccine, getting that COVID booster is really important. And so they should be kept more of as your friends rather than as an enemy.
Right.
Yeah.
That was great. Thank you for that. I was laughing at the you talking about Dr. Google because I know I find myself getting stuck down that rabbit hole and I fall victim to that sometimes too. So it's good to know that I'm not the only one. But yeah, you have to stop yourself from getting too deep into it. And is it, you're right, it does cause then a lot of anxiety and usually for no reason.
Yes, yes, I agree.
Um, well, thank you so much. That's all of my questions. If actually, I'll ask you one more. What's the one message you would like our viewers to take away after watching this broadcast?
I would say have a balanced approach to your life.
Mm.
Um, by and large, eat healthy, get adequate workout, keep time for yourself so that your mental well-being stays strong. Keep time for your social connections so you stay well connected with your friends, your family, your temple, church, mosque, whatever the case may be.
Yeah.
If nothing, you could always go to the library or give time, volunteer some time in the neighborhood shelter, serve a soup, fix a soup, but just stay busy, keep doing something. Like Martin Luther King said, if you can fly, you can run. If you can't run, you can walk. Or if you can walk, you can crawl. But incorporating from medical standpoint that same idea about physical activity, as long as you keep doing something towards your physical well-being, it all adds up. A journey of 1,000 miles begins with one step. So let's just take that one step today and keep ourselves healthy, safe, and mentally strong this whole year.
I love that. What a great way to end and ending with a Martin Luther King quote day after MLK Day. Thank you so much for answering our questions and giving all of your helpful tips. To schedule an appointment with a primary care provider at MedStar Health, visit us online at medstarhealth.org. We'll be posting that link in the comments as well. So thank you again, Dr. Sardana, for joining us, and we will see you next time.
Thank you so much for having me. I enjoyed the conversation as well. You have a great day and stay safe.
Thank you.
Bye.